Right now, COVID-19 is dividing college campuses all across our state. At UGA, students and staff are pushing for stricter COVID safety guidelines, while others say they are against mask and vaccine mandates. College-age kids and young adults have overtaken children when it comes to a surge in COVID-19 cases, which is only making the debate more intense. Christy Diaz joins us in the studio. And Christy, there are a lot of people going back and forth, but it's important to look at the numbers as well.
Francesca, there are two very different and very vocal sides to this debate. And this face-off is coming as COVID cases among college-age kids and adults are spiking here in Georgia. In many cases, the rates are higher now than they were this time last year before the vaccine was available. And it is causing a sharp divide. Yesterday in Athens, two groups showed up holding signs. One group led by UGA professor Dr. Janet Frick, who says she wants a mask mandate on campus. The other side led by Mike Francis, a UGA PhD candidate who says masks and vaccines should be a matter of personal choice. Now, before you hear from each of them, let's talk numbers real quick. UGA has a student population of about 40,000. Right now, it has more than 500 self-reported cases of COVID on campus. And then if you look countywide, the majority of 18 to 29-year-olds in Clark County are not vaccinated. Only about 20% of the college-age population has gotten the shot.
The numbers just don't support taking a, well, if you feel like it, approach.
Why should someone have to listen to the federal government instead of their doctor? A new vaccine is not the only way.
Now, currently, the university strongly encourages masks and they are offering incentives for vaccines, but the University System of Georgia has not mandated them for any public campuses. Francesca.
Christy, thank you. And just to take a closer look at the numbers overall, for the past month, kids 10 to 17 years old had the highest number of new cases. But over the course of the past week, those numbers started falling. Now, young adults between 18 and 29 are leading the way. And even though the numbers have fallen slightly, COVID-19 cases in children are still high. And this morning we have an update on when they could get some more protection. The nation's leading health experts say a vaccine for children ages 5 to 11 could be just months away from approval.
You could potentially have a vaccine available to children aged 5 to 11 by Halloween.
That is our goal, October. We are doing everything we can now to move these trials ahead, and they're moving ahead well.
Just around the corner. Now, once the trials are done, manufacturers can file for emergency use authorization. Then the FDA will evaluate the benefit and risk. That process could take just weeks.